Okay, so today we're going to study about the cerebral infarction. Cerebral infarction. Now, what is cerebral infarction? What are the underlying causes of the cerebral infarction? What are the risk factors? What are the signs and symptoms? And how we can diagnose and manage these patients. So in our today's video, we're going to study all these things. But before going into the detail of the cerebral infarction, first of all, we have to understand the difference of cerebral infarction and stroke. That we have to make the clear-cut difference, right? Clear crystal difference. What is the difference between cerebral infarction and stroke? Now let me tell you what is the difference. Now first of all, I'll tell you about the stroke. Now what is stroke? Stroke is a transient loss of cerebral function due to the decreased oxygen supply or decrease of blood supply. Again, what is stroke? Stroke is that you lost your brain function. You lost your cerebral function or brain function due to the decreased blood supply or decreased oxygen supply to the brain. And this loss of cerebral function is just for few minutes or few seconds or few hours. Now this loss of the cerebral function for few minutes or few hours, this is called stroke. But cerebral infarction is different than the stroke. What is difference? Now cerebral infarction is permanent loss of your cerebral function. That you lost your brain function completely, forever, right? What are the functions? Either one function or two or three or four, whatever function you lost of your brain, that's forever, for completely. That is called cerebral infarction. Now, for to understand the cerebral infarction, first of all, we have to study its causes. Then what causes cerebral infarction? Now, first cause of the cerebral infarction is atherosclerosis. Actually, for all these causes and for all these things for our today's lecture, I have written the English and Chinese as well. So if those of my Chinese students who cannot understand English, they can understand Chinese. So that I have written the Chinese with that. Now, again, come back to the topic. First cause is atherosclerosis. Now, atherosclerosis means that the hardening of our body arteries. That our arteries inside our body, they become very hard, they become very stiff, right? And what will happen, that naturally our arteries are very flexible. Let's suppose this is an artery. Now what will happen when the blood goes into the artery, this expand. And when blood goes out of the artery, it constrict. So relaxation and constriction, this is the natural property of, this is the natural characteristics of the arteries. Now what really happens, that when these arteries become stiff, right, that they cannot expand or they cannot relax. Now this stiffness or hardening of the arteries, this condition is called atherosclerosis. And when the patient has atherosclerosis in the cerebral arteries, that's suppose carotid artery or vertebral artery, they have the high chance to develop cerebral infarction. Now, another cause is thrombus. The second cause is thrombus. Now, what is thrombus? Thrombus is, as I have drawn over the structure over here, then let's suppose this is our central nervous system, as I explained in my previous video. This is the structure of our central nervous system, and let's suppose this is any artery which is going into the central nervous system, giving the blood and oxygen to the central nervous system, and then taking the deoxygenated blood out of our central nervous system. Now what will happen, that when there is a plaque formation, right, this we call plaque, right, this we call plaque, P-L-A-Q-U-E, plaque. Now what will happen, that whenever there is a plaque formation inside of our cerebral arteries, this plaque is called thrombus. Formation of plaque inside of our arteries, this is called thrombus. And when the patient develops thrombus in the cerebral arteries, let's suppose carotid artery or let's suppose vertebral artery, then when the patient develop these plaques and thrombus, they have the high chance to develop cerebral infarction. That's what this is a plaque, and due to this plaque, the blood which is going from this side, it cannot go to that side. So what will happen? The cells of our brain, which are present over here, here, they start dying. And when the cells of our brain die, this condition is called cerebral infarction. Now, third cause of the cerebral infarction is embolism. What is this? Embolism. Now, what is embolism? Embolism is actually the plaque which is formed, right? That's what this plaque is formed in the arteries of my lower limb, right? In the arteries of my leg. Now, what will happen that this plaque dislodges from there, and it goes into my heart and then into my central nervous system arteries. Now, when this plaque reach into the central nervous system artery, this movement of the plaque is called embolism. This movement that plaque is formed, this thrombus is formed in the lower leg arteries, and then it is moved into the cerebral arteries. This is called embolism. Or the patient, for example, the patient of arrhythmia, right, who have the atrial fibrillation or ventricular fibrillation, they have the high chances of formation of embolism. And this embolism, if it goes to our cerebral arteries, they have the high chance to develop cerebral infarction. So these were the three causes of the cerebral infarction. Let me explain again. Atherosclerosis, number one cause. Number two cause was thrombus. And number third cause was embolism. Now these are the different causes which can make the cerebral infarction. Now I have also explained there are the risk factor. There are the risk factor to develop cerebral infarction, means that if the patient have these conditions, they can also have the high chances, they have the higher chances to develop the cerebral infarction. Now what are the risk factors? Number first and the most important risk factor is hypertension. Now hypertension is one of the most common cause, and especially in the old patient and the patient who don't care about their blood pressure too much. Let's suppose the patient has the high blood pressure about 180 or 200, and they don't manage this blood pressure very carefully. So these patients have the high chances to develop cerebral infarction. Then the second risk factor is diabetes. Diabetes. That the patient who have the diabetes and they don't manage well, and they have the diabetes for a long time, they also have the higher chances to develop cerebral infarction. Then number third is smoking, right? Number third cause is smoking. That the people who smoke, what really happens that when the people who smoke, they have the high chances to develop atherosclerosis. And when the atherosclerosis develop, they have the high chances to develop cerebral infarction. So the patient who smoke, they not only develop the heart diseases, they not only develop the lungs diseases, but they also have the high chances to develop cerebral infarction and other brain diseases. Now, number four cause is obesity. That the patient who are very obese, right? They have a lot of fat in their body, and they don't manage their obesity very well, or they don't care about their food and diet, so they also have the high chances to develop the cerebral infarction. Then the fifth cause is hyperlipidemia. Fifth cause is hyperlipidemia. Hyperlipidemia is the condition in which in the patient blood, the lipid levels are very high. For example, HDL or LDL. Actually, when the LDL is very high, they have the high chances to develop atherosclerosis. So HDL or LDL or VLDL, what kind of lipid is there inside the body? So when the patient has the hyperlipidemia means high level of lipid inside their blood, they also have the high chance to develop cerebral infarction. So these are the five causes. That's what, again, let me explain. Hypertension, diabetes, smoking, obesity, and hyperlipidemia. So these 5 are the risk factors. It means they are not directly causing, but they have the high chances. If the patient has these risk factors, they have the high chances to develop cerebral infarction. Now, once the patient has these causes, and once the patient develops the cerebral infarction, how you know that the patient has the cerebral infarction? I mean that what are the signs and symptoms of the cerebral infarction? Now, there can be two kind of symptoms in the patient. One are the sensory symptoms. One kind of symptoms are sensory symptoms, that the patient loses all of his sensory function, right? His feelings, right? For example, the patient, if you touch the patient body, he don't feel. If you touch the patient face, he don't feel. Or if you give some food, he don't feel what kind of food is this. So the sensory function, like when the patient develops the cerebral infarction, they lose sensory function, so they develop the sensory symptoms. Another kind of symptoms are motor symptoms, right? Another kind of symptoms are motor symptoms, that the patient, when the patient has a cerebral infarction, they cannot move their body very well. And the third kind, another one of the most important things, that the patient mostly develops sensory symptoms and motor symptoms. But very important thing to remember the symptoms of cerebral infarction is that they develop the symptom in the contralateral side, right? Contralateral side. What is contralateral side means? For example, when the patient is developing a cerebral infarction in the right part of the brain, right, he will develop the symptoms in the left part of the body. He will develop the symptoms in the left part of the body. In the same way, when the patient develops the cerebral infarction in the left hemisphere, he will develop the symptoms in the right part of the body. Right part, right upper limb and right lower limb. So this is called contralateral side, means opposite side of the body. So whatever the symptoms are there in the patient, either sensory or motor, they are in the contralateral side, means opposite side of the body. So it means if the patient has the symptoms on the right side, you should highly suspect that the patient cerebral infarction is on the left side. In the same way, if the patient has the symptoms on the left side of the body, you should highly suspect that the patient cerebral infarction is maybe on the right side of the body. That is called contralateral side losses. Now, some of the common I have written down over here. Actually, the signs and symptoms of the cerebral infarction depends upon the location of the cerebral infarction. Right? Depends upon the location of the cerebral infarction, that which part of the cerebral infarction is died. Right? So the sign and symptoms, sign that if the location is here, so the symptoms are according to the location. But the most common symptoms which develop in the patient of the cerebral infarction, I have written down over here. That, for example, number one is pupil dilation. Pupil dilation, that this black part in our eyes, this is called pupil. And when the patient who develops the cerebral infarction, their pupil dilate, abnormal dilation of the pupil. This is one symptom. Another is abnormal light reflex. Now, what really happens that when you go to the neurologist, what really happens when they want to check your eyes? What really happens? They cover your eye and show the light in another eye, right? And this eye pupil will constrict. This eye pupil will constrict. This is called normal light reflex. But what really happens? The patient who have the cerebral infarction, in this kind of patient, this when they cover the one eye and show the light in the second eye, these pupil don't constrict. So they say they have abnormal pupil reflex. This is one sign and symptom of the patient of cerebral infarction. Another is lack of eye movement. Lack of eye movement. For example, in the healthy patient, we can move the eye here, up and down, right? But in the patient of the cerebral infarction, if you ask them to move the eye right or left or up or down, they cannot move it very well. So it means that the movement of their eyes are lost. right? That's called lack of eye movement. And then another is lack of movement of facial muscles, right? Again, lack of movement of facial muscles. That what really happens that the patient of the cerebral infarction, they lose the movement of their facial muscle. For example, if you ask them to smile, they cannot smile. Or if you ask them to smile, their one side will go to this other side and this side is not moving, right? So they cannot express the expressions of their face, right? Actually, our face has the tendency to show the different kind of expression. For example, anger expression, happiness expression, sadness expression, right? So the different expressions are expressed by our face. And the patient of the cerebral infarction, they cannot express any kind of expression in their face. So we say that their face is a lack of expression, right? Their facial expressions are lost. So we say that the lack of movement of facial muscle is there. Another common symptom is speech disorder, right? Another common symptom is speech disorder, or we also call it slurred speech disorder, or we also call it slurred speech. Now, speech, if you talk with this person, the patient of the cerebral infarction, they cannot talk very well, or they talk but you don't understand them, what they are saying. So they have the slurred speech. It means their speech is not clear. Then they have the hemiparesis. Hemiparesis. What is hemiparesis? Hemiparesis means loss of motor function on the one side of our body, right? Loss of motor function on one side of our body. For example, if you ask this patient to move their hands, they cannot move, right? Or move their hands, they cannot move. Move their arms, they cannot move. Or lift their shoulder, they cannot lift their shoulder. So if you ask this patient, they cannot do their upper limb or lower limb movements normally. So we say that if the loss of the movement is on the one side of our body, this is called hemiparesis. Hemi means half. Paresis means paralysis, right? It comes from paralysis. So hemiparesis means that paralysis of half side of our body, one side of our body. Another is periparesis. Actually, periparesis means that the loss of movement on the both sides of the body, right? If you ask them to lift their right hand, they cannot, right arm, they cannot lift. If you ask them to lift their left arm, they cannot lift. So it means that they have the movement, loss of movement on both sides of the body. That is called periparesis. Another very common symptoms in these patients is abnormal tendon reflex. Abnormal tendon reflex. That if you check their bicep tendon reflex, that is abnormal. Either it is very exaggerated or very low. So their bicep tendon reflex is abnormal, or their tricep tendon reflex is normal, or their you can say knee tendon reflex is abnormal. So they have the abnormal tendon reflex. That is called. So these are different symptoms. Let me review again. First is pupil dilation, then is abnormal light reflex, then is lack of eye movements, then we have lack of movements of facial muscles, and then we have speech disorder or slurred speech, then we have hemiparesis, and then we have periparesis, and then we have abnormal tendon reflex. Now, one thing you have to understand, two points which you have to keep in your mind. First point is that the symptom which I have told you, it doesn't mean that all these symptoms must be present in one patient. It doesn't mean that. These are the common symptoms I have told you. But the symptoms of the patient, symptoms of your patient depends upon the location of the cerebral infarction. Another thing which you have to keep in your mind is that all these symptoms, the patient of the cerebral infarction have the symptoms on the contralateral side, not on the ipsilateral. Contralateral side means opposite side of the body. Ipsilateral means on the same side of the body. So the patient of the cerebral infarction have the symptoms on the contralateral side, not on the ipsilateral side. Okay, if you understand the signs and symptoms, now we go to the management. Now we go to the management of these patients, that how, if you get the patient of the cerebral infarction, how you will manage these patients. For the management of these patients or the treatment of these patients, first of all, you have to understand that you have to manage underlying cause. Manage underlying cause. That you have to look out that what is the underlying cause for this patient, why he developed this, why this patient developed the cerebral infarction. For example, some patient develop a cerebral infarction due to the hypertension, so you have to very carefully manage hypertension. Or some patient develop the cerebral infarction due to thrombosis or embolism or atherosclerosis or smoking, or whatever the underlying cause is, you have to manage it very well, very efficiently, and very quickly. The second thing is thrombolysis, right? Before going into the treatment of these patients, first of all, we have to diagnose these patients. For the diagnosis of these patients, you can do some simple tests. First of all, we have to do the CT scan. That you can do the CT scan of your head, and in this we can see where is the cerebral infarction. But most of the time, CT scan shows cerebral infarction after 24 hours. So this you also have to keep in your mind, that if the patient of the cerebral infarction reached to you within 24 hours, before 24 hours, and you do the CT scan and you find that there is no lesion in the brain, and you say the patient is well, he can go back home. No, you shouldn't do like this. So you have to manage that the most of the time when you do the CT scan, the cerebral infarction lesion is observed mostly after 24 hours. So you have to wait for 24 hours for the CT scan result. Second thing you can do is MRI, right? Magnetic resonance imaging. And MRI is the gold standard test to diagnose patient of the cerebral infarction. It is very efficient and very clear, very prominent, and very, you can say, have the highest diagnostic value. And the third you can do is angiogram, right? Third thing you have to do that angiogram, that you have to angiogram is actually the CT scan of, you can say it is the MRI or CT scan of the arteries of your cerebrum or the brain. So you have to do this angiogram to find is there any abnormality in your cerebral arteries or not. So these three things, CT scan, MRI, and angiogram, will help you to diagnose these patients. After the diagnosis, we go to the treatment again. So for the treatment of these patients, first of all, as I already explained, that first of all you have to manage underlying cause. Then secondly, you have to do this thrombolysis. Second thing is thrombolysis. Thrombolysis means, for example, as I have shown you, that this is thrombus. This is the thrombus in the arteries of your cerebral artery. Now what will happen, that you have to remove this thrombus. You have to remove this thrombus. You have to dissolve. You have to break down this thrombus. Now how you break down the thrombus? One way is you give the medicine. And that medicine go and break down or destroy this thrombus. What kind of medicine we can give? I have written over here that first of all you can also give RTPA. RTPA stands for tissue plasminogen activator. If you can show over here that this is RTPA. RTPA stands for tissue plasminogen activator. Tissue plasminogen activator. This is a very important drug you can give to these patients to dissolve the thrombus. Second drug, which is mostly and very common to given to these patients, actually these drugs are a little bit expensive, but the most common drugs which are used for the thrombolysis are aspirin. These are given for a long period of time to dissolve the thrombus. So these are the drugs which are called thrombolytic drugs, which dissolve the thrombus. So we give these drugs for the thrombolysis. Second thing which we can do is angioplasty. Second thing is angioplasty. Now what really happens? What is angioplasty? Angioplasty is actually balloon therapy. Angioplasty is a balloon therapy. What we do, that we put a catheter from here, and this catheter goes and open this plaque, right? By the balloon, this artery go and open this plaque. So this is we also call balloon therapy or angioplasty. And the fourth thing which we can do is physiotherapy. There are different kinds of physiotherapies are done, like exercise or speech therapy, or what kind of different kind of physiotherapy is done in these patients. So this is all about our today's video. If you have any question or suggestion, you can email me or you can message me. See you next time with a new topic. Till then, take good care of yourself. Have a good day. Bye bye.